Let's continue with the biomechanical principles of osteosynthesis. Part 2. Load sharing versus load bearing. Load sharing means, as healing progresses, the bone and implant split the forces together. Intramedullary nails are the classic example. The nail is inserted through an entry point away from the fracture and sits inside the medullary canal, spanning the break like an internal splint. Under weight bearing, the bone with the nail resists compression, bending, and torsion. Because a nail usually doesn't clamp the fracture surfaces tightly together, the goal is typically relative stability, so the fracture heals by secondary healing. If the fracture doesn't unite because biology is weak or the construct leaves a persistent instability, the nail becomes the main bridge across the fracture, and with cyclic loading, it can initiate microcracks, often at stress concentrators like locking holes, because stresses spike at the hole rim as internal force flow detours around the opening. Over time, the microcrack propagates until the nail fails by fatigue. Bridge plating. When a fracture is multifragmentary and you can't anatomically reduce every piece, you can use bridge plating. The plate spans the entire fracture zone and is fixed securely to the two main proximal and distal fragments, restoring length, alignment, and rotation, while the intermediate fragments are left undisturbed to protect their blood supply. Mechanically, the plate also acts as an internal splint and provides relative interfragmentary stability, which promotes callus formation. Early on, because the fracture zone isn't compressed, the plate carries most of the load across the gap. As callus forms and bridges, the bone becomes stiffer and gradually takes back more load.